All right. This part is discussing our respiratory system. This is a very important part of our anatomy and physiology, and this is something that you should definitely get to know really, really well. The overall purpose of our respiratory system is to bring in oxygen to our body. And oxygen is a very important part of our body's metabolism, which generates our energy for us to do our normal daily activities. Without oxygen, we would not be able to perform very simple things. We would not have enough energy to perform normal things that we do. And often, because our size as living beings, that energy demand, if it's not met, then that could result in our death. So, there are a lot of different structures within our airway. It is divided into upper and lower airways, and we tend to use a region or a structure called the larynx as that dividing line. But first, we are going to point out some of the significant structures and what their overall purpose is. So we have our nasopharynx and nasal air passage up top. The significance of this is that our nasopharynx has the responsibility of warming and humidifying the air that we breathe. That is why we don't breathe through our mouth, because our mouth is not designed to bring in the air, warm and humidify it. And a good example of this is when you have a cold. If you get congested and you can't breathe out of your nose very well, you start to breathe through your mouth, especially when you sleep. And when you wake up in the morning, you realize how dry your mouth really is. That's because the membranes in your mouth don't have the responsibility of humidifying the air. Where in our nasopharynx and our nasal air passages, we have a lot of mucous membranes in there that are designed to add that moisture to the air that we are breathing, so it doesn't irritate the rest of our airway as it goes down. Then we have our oropharynx here. This is just our mouth and our oral cavity. So when we consume food, chew it up, it's going through the oropharynx. The epiglottis, which is the last structure of the upper airway, this is a leaf-shaped structure that covers our trachea when we are eating and drinking food, because we don't want anything other than the air that we're breathing getting down into our trachea, which leads down into our lungs here. So the epiglottis covers up that opening. Now, if you've ever laughed while you're eating or drinking and you happen to accidentally choke, or you get a little bit of water down the wrong pipe and you start to cough, when you make a noise like laughing, your epiglottis opens up because the sound is originating from your larynx here. And that would allow things that we are eating and drinking to sneak into our trachea and our airway. Then we have our larynx here, and we will take a closer look at that on the next slide. But this is also known as your voice box, and we will tell you why here in a minute. Then this leads into our trachea, or our windpipe, which is what it's also known as. And it splits off at a region called the carina, which is this bifurcation point. And the trachea splits into two pathways into each of the lungs. And then we have our right and left main stem bronchi here. And then it gets to smaller structures where we have the bronchioles, then down to our alveoli, which is a zoomed in picture right here. This is the actual functional unit of the lung. This is where gas exchange occurs. Everything beyond this point is simply a pathway. There's no gas exchange going on and nothing is happening. Now we have two lungs, one on the right, one on the left, obviously. So you would say these are bilateral. And the left side of our lung contains 2 lobes, and the right side of our lungs has 3 lobes. Lobes are just different sections. We can actually remove lobes surgically and still have functionality of our lung tissue. But the significance of the left only having 2 when compared to the right is that there's this region right here known as the cardiac notch. This allows the extra space for our heart to sit in between each one of these lungs. We also have some muscles of breathing. We have the main muscle here, known as the diaphragm. This is a dome-shaped muscle that comes underneath the lungs. So they kind of pull them down. And we'll discuss the function of the diaphragm in a little bit more detail with some more pictures. Then we have muscles called intercostal muscles. And these are in between all of our ribs. And these muscles help pull the lungs outward, so kind of widening the lungs out when we take a deep breath in. And so definitely know your pathway. Know that your nasopharynx humidifies the air and warms it up as we breathe it in. Our epiglottis protects our trachea from foreign bodies from sneaking in there. We have the larynx, which, as I mentioned, is your voice box, and we'll take a closer look at that. We have the apex of the heart, which is just the top. Then we have the base, which is the bottom. You have your carina, which is the split point between the main stem bronchi from the trachea. Bronchioles, which are slightly smaller. Then we have our alveoli. Our alveoli are very vascular. We have approximately 300 million alveoli between both of our lungs. And that should be enough surface area to cover a tennis court. That's a lot of space for gas exchange. And when we talk about the cardiovascular system in a little bit more detail, we'll talk about how circulation into the lungs plays a role. Now, let's zoom in on the larynx, as I mentioned. As I said before, this is also known as the voice box. And this is the larynx. Then when we look at it from the top, you can see our vocal cords right here. So we have some cartilage, which forms the cords with some membrane-like tissue. And these structures change position depending on which sounds we are trying to make. Then we have our epiglottis up here that folds over and covers this opening. Don't worry about these extra names of all the various different structures. Okay, just know you have your glottic opening, you have your vocal cord, and you have your epiglottis over here. Those are the main important ones that we want you to worry about. Then, looking at the anterior view of our larynx, it's mostly cartilage. There is one bone here called the hyoid bone. This is actually the only bone in our body that is not directly attached to other bones like the rest of them. We have thyroid cartilage here, which in males you would perceive as the Adam's apple. Women have this cartilage as well. It's just not as prominent. When you are exposed to excessive amounts of testosterone, it just causes this cartilage to grow larger. So that's why it's more prominent in males as opposed to females. Other than providing structural support for keeping our airway open, we have our thyroid, which is a endocrine gland that rests up here. And when we dive into endocrine, I'll talk about the significance of that one. Then just below here, we have our cricoid cartilage. Then underneath that, we have our cartilage rings of our trachea. Now, getting familiar with your thyroid and your cricoid cartilage is important, especially if you are going to move on to be an ALS provider, because you can use a landmark of the front side. So our thyroid cartilage comes to a point right here, and you can feel that when you feel the front of our neck. And as you run your finger down, you feel this little divot right here. And this is called your cricothyroid membrane. And this is actually a location where you can insert a surgical airway into someone's neck. So if we have an airway issue up top, maybe they have significant trauma to their mouth and we can't secure it with other means, ALS providers can surgically insert an airway in a secure manner. Now, also, the tracheal cartilages are important when we are talking about assessing pulses in infants. These are not well developed. So if you recall from your CPR class, if we are assessing a pulse on an infant, we are going to check their brachial pulse as opposed to carotid, as we would with older children and adults. Because we have undeveloped cartilage, there's a chance if we put our fingers on the trachea, we would possibly collapse the airway. And in infants, their airway is no bigger than a drinking straw in diameter. So we do not want to run any risk of collapsing that narrow, tiny airway. Then, last part here as far as the anatomy goes, we have these linings on the lungs and on the chest wall. And they are referred to as pleura. And as you can see, we have two different types, one called the visceral and one called the parietal. The visceral pleura, which is colored purple, lines the surface of the lungs. Then we have this parietal pleura in this darker shade of blue that lines our chest wall. And this slightly lighter shade of blue is called the intrapleural space or pleural cavity. The significance of these layers is to allow for smooth movement of the lungs when we are breathing and exhaling. Without these structures, they would rub against each other and the tissues would become very, very irritated. And when we go into our medical and trauma lectures, we'll talk about some conditions where these become disrupted and we end up with potential airway issues. But for right now, just know our pleura help create smooth movement for our lungs to expand and contract with normal breathing.